So always vagina is always compared to a rubber band. So as a rubber band once stretched from a base level to a maximum level, then getting back to the same old newer rubber band is not so possible. More number of childbirth, the vaginal laxity increases. So there is two types of treatment options. There is surgical vaginal tightening and laser vaginal tightening. So both these areas, extra vaginal tissues are separated from the adjacent organs. What is the post-operative advice? So coming to the post-operative care, what you have to give. Is it permanent and how much tightening can we expect? Pain is definitely going to be there, but bearable pain. Definitely vaginal area is always moist. So you always consider opening up your gynecologist. So intimate concerns are much more common than we actually think. So it's okay to be openly discussing about it and openly talking about it. So I'm speaking about vaginal laxity or vaginal looseness. So in a female, vaginal laxity can happen post-pregnancy and childbirth and also due to aging. As I commonly quote that collagen is present all over the body, same as in face, even the vaginal area, vaginal mucosa, body overall collagen content decreases as a female is aging. So post multiple childbirth is one of the triggering factor or one of the main factor where the maximum vaginal looseness is happening. So always vagina is always compared to a rubber band. So as a rubber band once stretched from a base level to a maximum level, then getting back to the same old newer rubber band is not so possible. Same way with the vagina is a quite elastic tissue where once stretched post delivery, coming back to the pre-delivery state is not so possible. So it probably comes back to a certain extent where laxity still persists. And if this trauma happens more frequently or more in number, more number of childbirth, the vaginal laxity increases. As so, because of aging also, vaginal laxity will be present. So there is not particularly a thing where you can prevent it actually. So coming to the main management or treatment options, so there is two types of treatment options where it's surgical vaginal tightening and laser vaginal tightening. So I'll be speaking about surgical vaginal tightening. So once you've completed your family, once you know that you're not going to deliver vaginally and there is no another future trauma to the vaginal distension, then you can definitely opt for a surgical vaginal tightening. So surgical vaginal tightening is designed so that you're with a surgery, we are tightening your vaginal caliber and getting back the pre-delivery vaginal caliber or the tightened vagina. So what exactly is this procedure? So before the procedure, we do run some investigations, make sure your body condition or you're fit for the procedure, and then we post for the surgery. So usually a vaginoplasty is not only the correction of the outer vaginal opening but throughout the vaginal canal. So it is anterior, posterior is the main two vaginal wall which we target when we are doing a surgery. It is done under a spinal anesthesia, that is a regional block where once the anesthesia is given below the tummy part, so once that is given, you're posted for the procedure, and anterior vaginal wall that is just below the bladder and the posterior vaginal wall that is just above your rectum. So both these areas, extra vaginal tissues are separated from the adjacent organs and excessive vaginal tissues cut out and then sutured or stitched more tightly. So once this procedure is completed, you will be preferably admitted for 2 more days, that is 48 hours with a catheter in situ so that the urinary bladder healing happens. And once the procedure is completed and post-op care is done of 48 hours, then you are discharged with proper post-operative advice. What is the post-operative advice? So coming to the post-operative care, what you have to give, obviously you will be given with antibiotics, painkillers and low creams or ointments to be applied, and also sitz bath which will help you reduce your perineal pain. And also we do advise no strenuous activity, no weight lifting or no anything penetrative to your vaginal opening, be it intercourse or tampons or menstrual cups. So this along with vaginal rest for 6 weeks is advised, and then your follow-ups after 2 weeks and 6 weeks is there with your concerned surgeon. This was roughly about your surgical correction, pre-op, during the procedure and post-op care. So when can you resume your sexual activities? One of the common concerns what we get, minimum 6 to 8 weeks, it's always good to not have any sexual activity post-procedure. Another question what we get is, what is the difference between laser and surgical vaginal tightening? Laser vaginal tightening we usually recommend in between pregnancies or when there is only milder degree of vaginal laxity, severe laxity, or when the family is completed. So it's always good to go for a surgical vaginal tightening to give you desirable satisfactory results. Another concern what we usually get is it permanent and how much tightening can we expect? Surgical vaginal tightening is quite permanent, and how much degree of tightening is we usually get back the vaginal caliber to the pre-delivery status, that is minimum around 2 fingers, that is around 3 centimeter width. Much less than this is not so possible. So that is one of the common queries or concerns we do get. And the one more concern commonly what we get is, will I get infection or will it be painful, and how is the post-op feel, what as a patient what you feel. See, post-op recovery takes its own time. Pain is definitely going to be there, but bearable pain. Obviously you will, in the hospital you will be given with injections for pain, and post-charge definitely you will be given medicines for pain. So it will be quite tolerable, and you can almost consider it much less than pain what you get after suturing an episiotomy or a post-childbirth suturing. It will be much less than that. Coming to the infection part, definitely vaginal area is always moist and healing is a concern. You will be given a proper solutions and proper guidelines as in how to take care of your perineum so that you will be preventing infections. So in gist, surgical vaginoplasty or surgical vaginal tightening is a very good option if you're concerned with your intimate time. So you always consider opening up your gynecologist and speak about it.